Om Dham Dhanvantare Namaha. Ragadirogan Sadhana Shaktan. Asheshakayan Prasatana Sheshan. Autsukya Maharidan Jakana. Yopura Vaidya Namosasasnai. Let me share. Today's topic is herpes zoster and paronychia. Herpes zoster occurs in the skin. The virus infects the skin and produces lesions. So, it is usually occurring in the course of cranial and spinal nerve endings. So, there will be erythematous area patches with the small vesicles in the beginning, and after that there will be papules and pustules and crust formation, and the crust peels off within 21 days. There will be mild, moderate fever also will be there, and it is known as Agni Sarpa in Ayurveda. And paronychia is a condition where there is infection of the nail bed, and that will affect the whole nail, and symptoms like pain will be there. Herpes zoster is caused by reactivation of varicella zoster virus. It is characterized by occurrence of group vesicles on erythematous base, which involves the entire dermatome, innervated by a single spinal or cranial sensory ganglion, and is associated with radicular pain. So this you see, the lesions are of herpes zoster. There will be pain, itching, burning sensation, and fever will be there simultaneously in the patient. So in the lesions, in some patients there will be pain, in some patients there will be itching, and in some patients there will be burning sensation in the near the lesions in a patient of herpes zoster. Here you can see in the forehead there are lesions which are of herpes zoster. Suppose it sometimes it occurs in the eye also, where corneal ulcer is also resulted, and there may be blindness. This is another area where you see the herpes zoster lesions are there. Here the spinal nerves are involved. You can see the erythematous lesions with the spine vesicles. It's also a small lesion of a herpes zoster. You can see erythematous lesions with the spine vesicles. And later on they will become pustule, then they will crust formation occurs, then crust is peeled off, and there will be healing. In some conditions, there will be complications or sequelae like post-herpetic neuralgia. That means the skin lesions will be cured, but there will be permanent, persistent, or recurrent pain in the course of the nerve. That is known as post-herpetic neuralgia. This is another patient with the lesions of herpes zoster. You can see in the spinal nerve course there is a number of lesions, isn't it? There are erythematous base and with the vesicles and the papules, the initial stage. This is another patient where in the back there are lesions of herpes zoster. You can see erythematous base lesions with the vesicles and papules. Here another patient, again you can see in the abdomen there is lesions of herpes zoster. You see in the course of the spinal nerve there are lesions, skin lesions, which are characteristic of erythematous lesions with the erythematous based lesions with the papules or vesicles initially. In another patient, you can see Above the eyes, right eye, you can see the lesions of herpes zoster. The erythematous, these lesions with papules in the center. You can see another patient with the lesions, isn't it? In the cheeks. So you see red lesions are seen. Another patient where below the eyes there is a skin lesion of herpes zoster. Now we will discuss the treatment of herpes zoster infections. Shamanaushadis are Sarivadhyasava, Chandanasava, Kamaduga Rasa with Mautika, Pravala Panchamrita Rasa, Mukta Panchamrita Rasa, Pravala Pishti, Pravala Bhasma, Mukta Pishti, Mukta Bhasma, and Divasma. The topical application are Shuddha Gairika Churna. You can see we apply dusting of Shuddha Gairika Churna to the lesions. You should not, water content should be avoided, best avoided, otherwise it will spread. Chandana can also be applied. Patyasa, Pittahara, Ahara, Vihara. Okay. And Narikera Jala, both these are Patyasa. Apatyasa, Tekshna Ushnahara, Vidagdahara, and Atapaseva. They are the main apatya. Even the exercise, it is also apatya. Now coming to Paronychia. Paronychia is an infection of the proximal and lateral fingernails, two nails folds, including the tissue that borders the root and side of the nail. Condition can occur spontaneously or following trauma or manipulation. Paronychia is among the most common infections of the hand. Paronychia results from the disruption of the protective barrier between the nail and the nail fold, introducing bacteria and predisposing the area to infection. Acute paronychia is usually limited to one nail. However, if drug induced, it can involve many nails. You can see the patient has the ring finger. You can change this in the nail and nail bed. That is the case of paronychia. You see infection in the nail bed, the nail, forming redness and edema in this region. Here also, yes. The other patient having paronychia. Usually, the females, women who are working in the with the water contact for cleaning the utensils, etc. Water and chemical contact, they will suffer from paronychia. Even the trauma will lead to paronychia. Trauma to the nail bed can also cause paronychia. Here you see the patient with paronychia. You see nail bed is infected and inflamed. There will be pain also. The other patient with paronychia. You can see ring finger shows inflammation, redness, and swelling in the nail bed. Nail color is changed, isn't it? The other patient where the thumb, okay, right thumb is suffering, is affected by, there is development of paronychia. You see, nail bed is inflamed and swollen. Nail also color is changed. The other patient is having paronychia. Okay. The nail bed and nail is affected. Here you see thumb is affected. Nail bed is inflamed. Okay. Redness is there. Tenderness is also there. Nail is also affected. Okay. To some extent. Nail becomes brittle. Sometimes it will drop. It will be dropped, isn't it? Here you see the nail, the middle one is infected. Nail bed is infected. Nail is also affected in the case of patient of paronychia. There is a bacterial infection. The other patient with the great toe having infection. The bed, nail bed, and the sides they are infected, reddened, and the pain is there. When pus is also formed. Here is another patient who is having Paronychia. You can see the roots sides of the nail is infected. That and painful. There is another patient where the great toe is affected by Paronychia. The nail bed and the nails are infected by the bacteria. You can see in this patient, the great toe, there is infection. Nail bed is infected. And nail color also changed. Is also a patient of Paronychia. In this patient, you can see the great toe is having features of Paronychia. The nail bed and the nail is infected. Redness, swelling are present. Pain is present. Is also the great finger, thumb is having infection. Okay. The nail and nail bed is infected, redundant and swollen. Here you see the ring finger is affected. The nail and nail bed are infected by bacteria, and there is swelling and redness. There may be pus also formed. In some cases, pus will be formed. The nail is rain drop takes place. There is another patient where the ring finger is affected by Paronychia. You can see reddened area and altered color in the nail bed. There is another patient with the Paronychia. The second finger, the nail bed is infected. Nail also is color is changed. The patient will suffer from pain in the nails. The patient of Paronychia. Now coming to treatment. Shamanaushadis Gandakarasana tablet, Sarivadhyasava, Chandanasava, Rasamanikya, Arogyavardhini Vati, Mahamanjishtadi Kashaya, Mahadiktakam Kashayam, Patola Katoranyati Kashaya. You can select according to the patient's constitution, you can select the drugs, the formulations, and prescribe. The follow can also be given. Rasamanikya is given in Rati dosage, 1 or 2 Rati. 1 Rati, thrice daily, like that. It is mixed with the other drugs like Ashavandha Churna or Tripla Churna, etc. And topical applications are Gandhakadya Malahara, Demigathini ointment, Gandhakarpura Malahara. This can be applied. And also the contact to the water and chemicals should be avoided. Isn't it? The utensil cleaning, etc., or washing, etc. While doing that, there may be contact infection, and there may the infection may increase. So pathas are we have to avoid ushna ahara and also contact of water and chemicals to the nail, to the hand. Okay. Pathas are tikshna ushna ahara and vidaya ahara. So today we have discussed the conditions herpes zoster infection and Paronychia. Thank you for patient hearing.